This is QD Video and I'm Jack Cush. QD Video is brought to you by RheumNow.Live. Curious, mind-bending rheumatologists who like to teach will show up at RheumNow.Live in Fort Worth on March 22. So today's case is 0 to 60 in 2 months. This is a 41-year-old gal with psoriatic arthritis. She also has a diagnosis of psoriasis, pretty widespread, I would say. Has had fibromyalgia in the past, been treated with Areva, Cimzia, Aleve, Tramadol, and Trazodone. It seems that she was treated by a previous rheumatologist. Her insurance changed. She lost the doctor. She had to stop taking her last DMARD, which happened to be certolizumab. And she comes to me having not seen a rheumatologist in about 12 weeks. When I see her, she's a gigantic mess. I mean, she's a polyarticular, polysynovitis, 3 hours of stiffness. Her CRP is 210 milligrams per liter. Her CDI score, I use a GAS score, which is equal to a CDI score, GAS standing for global arthritis score, was 45, which is like gigantic. She had, I believe, 14 swollen, 19 tender joints. And when I saw her, she's just taking Aleve, Tylenol number 3, and that's it. And the question is, what can you expect from reinstitution of therapy? Again, 12 weeks, she's been without Cimzia. Again, she's got really, really bad numbers of presentation, a lot of juicy joints, a very active skin disease. So what did we do? We put her back on methotrexate. That seems like the right thing to do. She has no real contraindication of methotrexate. We gave her the choice of going back on a TNF inhibitor. She'd only received one, or going on tofacitinib, and she chose to go on. She really wanted to be on pills. She said she was having a problem with the shots. So she goes on the pills. We see her on 12/13. She comes back on 6 weeks later. And what would you expect 6 weeks later when you see this patient? Well, she's had a dramatic response. Her skin basically all went away. And I'd say she had about 10% PsA, total body surface area, as far as her psoriatic lesions, including her scalp and behind the ears. Her joint count went from 19 and 14, tender and swollen, down to, survey says, 10 and 6. Her GAS score, CDI score, went from 45 to 11. She still has active disease, and she's about to break the threshold probably soon into getting into low disease activity state. And her labs are pretty bad. She has marginally elevated SED rate, rheumatoid factor and CCP, 16, and I think the other one was 20-something. Her ETA, her 1433 ADA, ident-RA was really high at 2.69 nanograms per milliliter. But we do know that can be elevated in up to 15–16% of patients with erosive polyarticular psoriasis. Is this RA? It looks like RA. It's polyarticular, but her other seropositive markers are relatively low titer. She's got very bad skin disease. This is very bad polyarticular psoriatic arthritis. I guess the point here is that aggressive treatment can result in aggressive reductions in disease activity, in inflammation, really overnight. And again, that CRP that was 210 is now 10. The ESR, what was it? It was 100. I think it's 20-something at this visit. So, and I'm making a pitch for aggressive disease merits aggressive therapy. I'm making a pitch for rapid turnaround times and assessment. The idea of waiting 6 months for someone to respond is a gigantic mistake. And often that's like, well, let's see what happens and whatnot. No, many of the drugs we use have a 0 to 60 that's really quite impressive. And that's what happened here in this case. This patient had, again, almost a 75% reduction in disease activity in 6 weeks. It is expected that she's going to continue. So I'm going to keep her on the same course. We did not need to use any steroids in this individual. She's just on methotrexate, which she just started 6 weeks ago. We're going to keep her on both drugs until she gets into full remission. And we'll follow her. So again, Q6 weeks until they get better. If they're not better in 6 weeks, dramatically better, after the first 6 weeks, think about changing. Why not? Why prolong the misery? If they don't hit a home run within 6 weeks and have a home run response, are you looking for just a little bit better in someone who's got severe polyarticular RA or PsA? I think not. That's it for QD. See you next time.